Hey, Holly here from Sisu Practice. Let's talk a little bit about the differences between treating female anatomy perineally and male anatomy. So the muscles are very similar. The big difference, and one of my students once described it as in a male, the bulbospongiosus is zipped up, is that muscle is zipped up. There is no vaginal opening. So different approaches that you can and should take to assessing male perineum are setting up for that person to know that you are going to be walking up on that muscle between the testicles. Techniques you can use are to ask for little squeezes so you know when you reach the height of that muscle and when you need to start treating back down. You can also give the option for the patient to have a drape underneath the testicles to pull them up and away so that you can access those muscles clearly and determine what your course of care is going to be. As with treating any perineum, I still suggest that you treat opposite side so that you are in an open shoulder situation instead of closing down and trying to feel things equally. It's not that treating same side is the wrong way or a bad way. It's just simply going to offer you another approach, another way to flip your hand and potentially dry needle against that pubic arch. So I highly suggest that for longevity in your body. And then you can really assess exactly equally on both sides when you have a session that allows the time to do that. I also suggest you educate the male patient about these muscles. Bulbospongiosis and ischiocavernosus are key players in sexual function in supporting erection, ejaculation, detumescence, and the more that you can teach, the better. Other pieces of male perineum that are going to be a little bit different is it might be a little bit more narrow. So take your time. Just like in the video prior about assessment of female perineum, make sure you utilize those bony landmarks so you know exactly where you are instead of making assumptions. That's going to help make that treatment more specific, more precise, and help you layer up more advanced techniques with dry needling or dry needling with neuromodulation.